So the goal for most agency leaders as they look to improve their organization and really look into their operations is to streamline those operations in a way that it ensures every department across the organization is able to focus their resources into both performance and improvement in really three major areas: financial outcomes, OASIS performance, and then probably most critically the overall quality and patient satisfaction outcomes for the organization. What we see in these organizations are three major themes. One is that their staffing costs and their staffing resources are too high. It's not structured in a way that ensures the highest possible operating and quality outcomes at the most efficient cost. Additionally, in these organizations, what we typically find is that their clinical model is really not specified in a way that allows them to truly meet the true home care core competency to ensure that every single patient that comes into their organization receives the highest possible level of clinical care, and that we truly drive the outcomes for every patient in a best practice manner. The second thing that we find, and this is really pervasive across the industry, is they haven't spent the time really thinking about their operating workflows. Their processes are not efficient, they're redundant, and they're really not driven to produce the kind of results that they're looking to produce across the organization. What happens is staff become frustrated, costs rise, and agency leaders sit there and scratch their heads trying to figure out why their performance targets aren't met. The third thing is that even though we've continuously looked at OASIS and OASIS performance, is that agencies are still not maximizing in the appropriate way their Medicare revenue. We see that clinicians are still not competent with respect to OASIS, and there's certainly room for improvement on that Medicare operating revenue side as well. What we look at when we do an operation review is we look at every single department across the organization. We want to make sure that everything from marketing to intake to the clinical shop to quality, even looking into HR, the accounting shop, the finance shop, are truly operating in coordination and collaboration so that overall outcomes can be achieved from every perspective that agency leader sets those targets. What we find is that these common themes really rise up in almost all organizations. We look to identify the issues from an individual perspective in that organization and quickly move to develop specific recommendations to help these agency leaders maximize their performance. When it comes from an outside perspective, as an organization providing these consultation services, we find that we're really able to help partner with that agency leader to help make these changes. It seems to be much more effective when it comes from an objective outside source.